My name is Kaci Magyar, and I'm with the Simpsonville Area Chamber of Commerce. On behalf of the Chamber, we're truly honored to welcome the Blood Connection to our community. Your mission to save lives and serve others aligns perfectly with the values that define Simpsonville: service, compassion, and community. We are grateful that you've chosen to invest in our city and become a part of our growing business family. Your presence will make a meaningful impact not only to our local healthcare efforts, but also countless lives across our region. Thank you for the important work you do every day, and thank you for choosing Simpsonville as your home. We look forward to a strong and successful partnership for years to come. And on behalf of the Chamber, we'd also like to welcome Delisa English, the President and CEO of the Blood Connection.
Thank you, Kaci. Good morning, and thank you all for being here today. As Kaci said, I'm Delisa English. I'm President and CEO of the Blood Connection, and truly it is thrilling to be here today. I want to begin by thanking the Simpsonville Chamber of Commerce and our city leaders, hospital and community partners, board members, our amazing TBC team, and most importantly, blood donors, who are the very reason we're here and who have made today possible. Your presence here today reflects a shared commitment to protecting the health and safety of this growing region. The upstate is growing rapidly. Countless families are moving here, and we've all seen the national reports of this area being a housing hotspot and a must-visit area. Businesses are opening and expanding, more cars are on our roads, and more children are being born daily. The national awards don't surprise any of us because we know how wonderful this area is because it's home for us. But with this growth comes something that we don't always think about until it's urgent, until it's needed, and that's blood. As our population increases, so does the demand placed on our hospitals, on our emergency departments, and trauma teams. And in every critical moment of care, the blood must be available. And that's why we're here today. The Simpsonville Community Blood Center is not just a new facility. It's a response to the growth. It's preparation. It's a promise that as this region expands, life-saving care will keep pace. The demand for blood is right before us every day. Like me, I'm sure you've seen the news headlines of car crashes, traumas, and hit and runs. But if not, let me just give you a glimpse into the demand for blood and how it impacts us here locally. What it looks like is a teenager being rushed to the emergency room right after a serious crash on a Saturday night. Surgeons are waiting, trauma teams are ready, but the outcome depends on whether blood is already on the shelf, not hours away, not in transit, but there immediately when it's needed. It also looks like a mother who arrives at the hospital excited to deliver her baby, only with complications arising. Within minutes, doctors must act. Blood loss is rapid. Decisions have to be made within seconds, and blood is what allows that mother to live and be able to watch her child grow up. It also looks like a child fighting cancer whose treatment depends on repeated blood transfusions, week after week and month after month. Blood isn't an emergency resource in this case, it's an ongoing essential care. It also looks like a patient living with sickle cell disease who arrives in crisis, racked with severe pain, exhausted, struggling to breathe, needing specialized blood to recover. That blood can't be improvised, it can't be manufactured into existence. It must be already available for them. It has to be donated by someone who understood the importance of giving. And for medical staff across the upstate, this is not a one-time emergency, it's a lifelong reality. These moments happen every day, quietly, relentlessly, and most of the time without headlines. You don't know their names: Reese, Kristen, Chantrell, Kayla, Luca, Eliza, or countless others, but we do, because they're a testament to our life-saving mission at the Blood Connection and the sacrifice to our neighbors to make sure blood was available for them when they were running out of every other option. So here is the reality. Blood can't be manufactured. There's not any substitute. every single unit comes from one neighbor who chose to give, rolling up their sleeve for someone that they will never meet. So as hospitals across the upstate work tirelessly to serve this growing population, we've got to have access to a strong blood supply, and that's critical. This center here today expands this capacity to meet this growing demand by increasing access to whole blood, platelet, and plasma donations, each one life-saving in its own way. So the Blood Connection is proud to serve as the sole provider of blood to upstate hospitals, supporting our healthcare partners who stand beside us, caring for families across the region every day. Our responsibility is clear: to ensure that blood is available when lives depend on it. This center strengthens that commitment, but buildings don't save lives. People do. This facility will only succeed because donors step forward, donors who are here today donating blood and who will come in the future, because partners like we have here today stand with us, because this community understands that preparedness is not optional, it's life-saving. So Simpsonville and the upstate, our commitment to you is to ensure no patient is ever left waiting for blood when the time matters most. We're proud to serve this community, and we're ready to answer the call when it comes. But to do that, we need you to answer the call and to show up and donate every chance you can. Our team is here to answer the call with you. So let me put it to you this way: will you answer the call with us? I hope so. Now I'd like to introduce our first speaker, one of our great partners, the president of the Greenville Drive and a member of the Blood Connection Board of Trustees, Jeff Brown, and a great friend of mine.
Thank you so much, Delisa. You're probably wondering what the president of a minor league baseball team is doing here, speaking at the opening of a new blood center, but hopefully that'll make sense after the next couple of minutes. My name is Jeff Brown. I'm the president of the Greenville Drive, and I jump at any opportunity I get to speak alongside our longtime partners, the Blood Connection, Prisma Health, Bon Secours, especially around what I feel is one of our community's most important critical issues. And on the surface, so the Greenville Drive, for those of you that don't know, we're a high A minor league baseball team affiliated with the Boston Red Sox. We play at a true replica of Fenway Park in downtown Greenville. The baseball side of our business is incredible. The Red Sox are incredible partners. This will be our 21st year in the community. We've had 130 plus kids really come through Greenville that have gone on to a big league roster across the last 2 decades. And the baseball side of our business, as a baseball fan, baseball's in my blood. I love what I do, but baseball is not why we're here. And I always say, when I have an opportunity to speak, that our business has been, will be, and always will be about so much more than baseball. And there's really kind of no better initiative, no better example than the work that we do with the Blood Connection every year on our platform. About 15 years ago, one of the newspaper outlets in town referred to the Drive and Floor Field as the front porch of the community. And once we understood the symbolism of what the front porch meant in the South, a place where our community can gather, where we can celebrate, where we can spotlight what's important to our community, important community initiatives and the like. Once we understood what that really meant, we've wrapped our arms around that positioning. Every year it's something that we try to live up to, and it's why our relationship with the Blood Connection is our best example of how we try to take the Drive to market every day. There's no issue that's more critical to our community than our community's blood supply. And for 15 years, working with Delisa and her team, we use the excitement of Drive baseball and year-round community events to really educate the community, to inspire the community, to emotionally connect with the community, and then to hopefully convince the community to donate and give back through blood donations each year. And I didn't know anything about blood donations and blood supply when I first moved here 10 years ago, and meeting Delisa, our partnership with the Blood Connection, joining the board. Delisa already kind of mentioned some of the statistics, but I'm blown away every year as I learn more and more and more about how a community can't really run or can't run without an effective blood supply. The fact that every 2 seconds in our country somebody needs blood. The fact that nearly 800 people a day need to donate blood in our community just to service the needs of the hospital systems that the Blood Connection supplies. And the fact that Delisa mentioned this, but the only way that we get blood is, but it can't be manufactured. It has to be given from one person to another. It's kind of the ultimate selfless act. So once we've really understood the realism and then the emotion behind the act of donating, it's a story that we try to tell every year at Floor Field through our partnership. And that's why, honestly, I'm so proud of the last 5 years. We've had 1,800, almost 1,800 units of blood collected through efforts with the Blood Connection and the like. And it's something that we celebrate because, again, it's the selfless act of one person giving to another. And it's something that, if you feel so inclined, we encourage the community to do every day. So that's why I'm proud to be here this morning. That's why I'm proud to partner with the Blood Connection, and why we are partner with the Blood Connection and have Delisa as a personal friend. As individuals, as families, as you operate businesses and the like, I highly encourage you to learn more about the Blood Connection, learn about how your company can contribute, how you individually can contribute, because it truly is, you have the ability to impact lives and change families' lives, people's lives through donation. So congratulations to Delisa and her team. I believe this is the sixth blood center now in the upstate. And the lives that will be changed because of this facility is incredible. So again, thank you all for being here. Really appreciate the opportunity to speak. Thank you to Delisa and her team, and thank you again. It's good to see you.
Thank you, Jeff. The partnership that we have been, as Jeff mentioned, with the Greenville Drive really is a great example of the community partnerships that really help, it embraces and embodies what it means for the entire community to support blood donation. And thank you for your leadership in that effort, Jeff. But also with us today are other people that we are here to support, and that is our valued hospital partners, the reason why we're here, the people who deliver health care in our communities. And I'd like to introduce, first of all, I'll introduce Dr. Surrey Gower, who's the Chief Medical Officer at Bon Secours St. Francis and also a member of our Board of Trustees. She'll speak first, and then following her will be Dr. Kelly Johnson, Assistant Medical Director of Emergency Department at Prisma Health, Hillcrest Hospital. Both of these ladies will speak about what it means to have blood available, but also are instrumental in delivering on health care in our community. So, Dr. Gower.
Good morning. I'm excited to address you all on a soggy January morning, but it's lovely in here, and that's all that matters. Everyone has such beautiful words. I'll try to keep it brief. I'm here today as a Greenvillian, as a Bon Secours physician, and a proud member of our Blood Connection board. It's such a pleasure to be here today to usher in yet another milestone in Blood Connection history. This particular corner of the upstate is growing and thriving, and I believe this center will help further the Blood Connection's mission of procuring, cataloging, distributing precious blood and blood products to those in need. When I used to recruit physicians at St. Francis, I had a statistic that said 33 people moved to the upstate every day. And I think that's incredible. And I like to think that that's still true, and probably that number is higher, and that just illustrates the need for blood and blood products. Can't say it enough, blood saves lives. It always bears repeating, blood saves lives. And it's not just for trauma, it's not just this Hail Mary and a catastrophe. It's incredible how much we depend upon it for routine surgeries, ongoing cancer treatments, pregnancy, delivery, obstetrical complications, things that you don't really think about as a patient or even sometimes as a clinician. I've had the privilege of seeing the value of emergency blood products firsthand, and it's something that we don't necessarily appreciate until or unless it's not there. We are fortunate in this country that that is a mainstay of medical treatment, and you only realize it when, for whatever reason, you can't have blood. When you turn around and you ask for them to hang the blood and they say it's not here yet, or we don't have it. That is a moment that no doctor, nurse, or healthcare practitioner really wants to ever hear. I know that Bon Secours St. Francis is grateful for its partnership with the Blood Connection, and I'm sure the dozens of other hospitals and communities that the Blood Connection serves are thankful as well for the support and their efforts. I just want to remark that in a time of rising societal tension, divisions, and unfortunate rising skepticism around medical science, I see this building and the Blood Connection as a symbol of the intersection of medical technology and the graciousness and generosity of human beings to one another. There is nothing more humanitarian than actually giving a part of yourself to save a stranger that you don't know anything about and are unlikely to ever meet. And if that doesn't encompass, I would like to think, core values, I don't know what other sentiment does. So thank you to all the people who have worked very hard to bring this center to fruition, and thank you for your time.
Thank you, Dr. Powell. Good morning. I'm Dr. Kelly Johnson. I'm an emergency medicine physician with Prisma based at Hillcrest and the assistant medical director of our emergency department there. We are thrilled to have this beautiful space as in our community to help support the needs of the community and the community blood supply. As others have said, I cannot emphasize enough the importance of blood and blood products to our patients, whether that's in a trauma, whether that's with obstetric complications, whether that's a cancer patient who needs ongoing blood products throughout their treatment. We, in our emergency department, we use blood products pretty much every single day. And it's, we are fortunate in our community to have the Blood Connection as a partner that's able to help us supply that. When your patient needs that, there's no other treatment other than blood. When they've got blood loss, you replace it with blood. There's nothing else to temporize or fix it. And we are very, very fortunate to be able to treat our patients that way. Again, I would just encourage everyone, please donate yourselves, encourage your family and friends to donate, make it an ongoing habit because it is an ongoing need. And others have said too, the population in this area is booming. So as more people come in, our need is going to increase as well. And we are, again, very fortunate to have this beautiful space in our community. And we are very grateful to be able to partner with the Blood Connection on an ongoing basis. Thank you.
Thank you so much.